Hi, I'm Shane.
And I'm Christy.
Welcome to the Food Drives the Mood podcast.
Food for your plate, food for your mind and soul, food for your body. Welcome to our show. We are here today with Dr. Bedford in Greater Washington, and he is a chiropractor, and we are going to just give him the floor. First, I want to ask why chiropractic care did you ever get into being a chiropractor?
I graduated from chiropractic school back in 1996, and the reason I became a chiropractor at the time, I was working for social services in New York State and Child Protective Services, and my wife, who is my wife now, we were engaged at the time, hurt her back and she couldn't move for a few days, and I drove her to the chiropractor. I didn't know what a chiropractor was at that time. My family never used them. Her family grew up with chiropractors, and I helped her up the stairs. The chiropractor was on the second floor, and we had to climb some stairs and got her up there, and it was a female chiropractor, and she adjusted her low back and she could walk, and I was just blown away by that. I watched her do that adjustment of the low back, and I'm like, what could have that possibly have done for her? And it did a ton. So I asked that chiropractor if I could do like an informational interview with her, and I came back and observed her for half a day, and I love the fact that you use your mind and your hands, so it's a blue collar, white collar type job, and within 3 months I was doing my pre-med, and within 6 months I was in chiropractic school. So
cool. Yeah. And then how long did it take you to go through chiropractic school?
So after your bachelor's, you have a choice of two tracks. Traditional schooling would be 5 years, but if you go all year long, you can do it in 3 and a third years. So there was about a week to 2 weeks between each semester. So it was, we decided to do the faster because it's cheaper to do that in the long run. So you
had said you had never been to a chiropractor, but your wife had been before?
Yeah.
And so she just wanted to go because she knew it would help.
She knew it would help because her parents had both been to chiropractors in the past. So this leads to another question that I had is, I think a lot of people that have never done chiropractic care before will only do it if and when their back hurts. Like that's when it's like the last straw sometimes. Like they've never been, family's never been, and then they're like, oh, my back hurts, nothing else will help, then I'll go to a chiropractor. But is that the only time that they should see? Like, when's the best time to see a chiropractor, or who should see one? Should you wait until your back is hurting before you go? That's a great question. So, you look at a lot of the sports teams now, NFL, NBA, baseball players, they all have chiropractors on the sidelines that help them. And a lot of those athletes do have musculoskeletal problems, but a lot of them just want that spine to be working optimally before they go onto the field. It's a piece of machinery that needs to be fine-tuned. So you'll see a lot of athletes from high school to college to the pro sports use chiropractors just so that they can have an optimum level of play. The PGA has a chiropractor that tours with them. In the wintertime, he does the U.S. ski team, and in the summertime, he does the PGA. So if you're looking for optimal function of the spine, it's good to do it anytime. But we do see a lot of people that it's their last straw. They've tried everything, and the first thing we hear is, I wish I would have done this 3 months ago, or I wish I would have done this 3 years ago. That's what we hear from people.
I'm kind of on the same track. Based upon my personal experience, it took me going to see a few chiropractors over a course of a lifetime, so to speak, to find somebody that was I consider good and actually helped me instead of maybe pose some kind of unusual techniques and procedures. So the profession, I might be wrong here, but might have like kind of a negative connotation in some people's eyes because of past experiences, not unlike any profession. So I'm not trying to single this one out, but what do you tell those people that, that kind of have a bad or a misconception about chiropractic?
Yeah, you mean we'll hear that people tried chiropractic and it didn't work for them, and they've tried one chiropractor. I'm glad you've tried more than one, and that chiropractor didn't work for them. But you'd never go to a dentist and say, I tried dentistry, and try one dentist and say it didn't work for me, or go to a medical doctor and have a bad experience and say, I'm never going to medicine again, right? The fact that you were willing to to go back and find the fit for you. And it's no different than in any profession. There's got to be a fit there, and you have to feel like you're being taken care of in the way that you want to be taken care of. So.
I think when I first started going to, I've been to a few different ones, but I obviously go to you pretty regularly. And my dad was like, you better be careful. Like, they're just want your money, they're going to keep making you go until whatever. But I don't get that vibe from you ever. And it's always like, we see you until we feel better, and then there's always an end. And so my dad has not had that same experience, so he's kind of pushed back on it. But
yeah, I've always thought that to be curious. I mean, that whole, once you go to a chiropractor, you have to go to the rest of your life. You would never say, once I go to a medical doctor, I've got to go the rest of my life.
Right.
They get you from birth, and then they get you the rest of the life.
Right.
I mean, you would never say that with a dentist. You would never say, once they get you have to go. You have to go if you have a musculoskeletal problem. That's when you have to go. If you have a cavity, you have to go. I mean, with dentistry, people do choose to do wellness care, but I don't know any chiropractor that has the power to force anybody to do anything against their will, going to a chiropractor. So I've always found that a curious statement to look at healthcare.
I see a lot of people that I've talked with about, if they go to a chiropractor or not, they almost feel like once they start, whoever the practitioner might encourage them to come back like on a regular basis or something, and for some reason they feel like that's like they're being pushed or maybe tricked into something. So it could be in just in the delivery of how that person is working. It might be just a rub between the personalities, but I do hear that a lot when I talk to folks.
Well, we're in a sick care society, right? So we wait until we're sick to do anything, right? And the chiropractic takes it from the viewpoint of wellness care, right? And so if you have a chiropractor that's suggesting you check back in every 6 weeks to 2 months. It's similar in dentistry where they would say you should have your teeth cleaned every 6 months. I mean, in dentistry, there's a lot of people that choose not to do clean and wait till they get to that sick care stage to do anything. And I think that's what they're trying to communicate when they say we'd like to, you benefit from this because you sit at a desk all day long, you're inactive, or you work so hard, you're shoveling in the ditch all day long. It would benefit you to be seen before the problem happens. And a lot of times it takes a lot less treatment if you go in sooner than later. I mean, if you wait until with like medicine, if you had heart problem and you got pain going down your arm, that's not when you want to start taking care of your heart. You wanted to do that years ago. And it's the same with this. It's cumulative trauma over time that adds up to be a problem. So
does it depend on the person, like you said though with the dentist, where they it's typical you should go every 6 months for preventative care? Should you do that in a chiropractic care, just like I think it depends on the person
and the circumstances. It's different, right? In the fact that you might be, right now we're seeing a lot of people that sit and they're doing home offices, and a lot of times those home offices are at their dining room table, which isn't optimal for them. So those people are being seen a lot more in our office now than they would be if they were in their regular office, and it really depends on the circumstances and how you're using your spine. And our job as chiropractors is to educate people on, okay, now you're in this situation at home. What are we going to do about it? Because we don't see an end right now for you. It's going to be a long-term issue for you. And some people, it might be, the rest of their careers, they might be working at a home office. So what are some of the solutions we can come up for you to make that optimally? And then how can we help you along the way with that?
In those solutions, are you telling people like a standing desk is good, or does it depend on? Giving
all sorts of suggestions. One of the, we're fortunate the local PUD here has been really good about taking care of their employees. So they'll bring their chairs to them, and a lot of them don't know that. So we'll just let them know that that's an option. Or if it's someone that can't afford a standing desk, I did a lot of postdoctoral training in neurology a few years back, and I used a milk crate that I tipped upside down and I put my laptop on it. So, it's just being creative with the space that you have. Not everybody can grab a Veridesk and bring it home, or has the space for it, because you might want to eat your dinner on that table, at some point, right? So,
Gunnar is at home now, and that's what he did. He has his table, and then they have a crate and a couple books, and then that's his laptop.
Exactly.
He's standing
and it works, right? It works. Yeah. And and then taking more breaks and taking more time for yourself. If you're standing at home on a tile surface, you might want to think about getting some sort of anti-fatigue surface underneath you, or wearing better shoes while you're doing it, or you're at home, and so you don't really have the built-in breaks you would necessarily have, and setting those reminders to say, I need to get up and move around.
Or even the movement is, because I mean, this is my first week back teaching, and I have a stand-up desk, and so I use that. But in my classroom, normally I am constantly moving, and now I'm just like in front of my monitor in this stand-up position, and so I'm not moving like I normally do, and I find that is really different. I mean, I'm still working out and doing those, but that just like the
challenges are different than they were.
Yeah. But it's definitely.
That's kind of a segue, kind of going two different directions. So I think I'll backtrack first, and we can move forward with this one. You mentioned that you did some work with a neurologist. Can you tell our listeners kind of what kind of training and what's different about a chiropractor, say a general practitioner in the medical field?
So what I was saying earlier is that I did some postdoctoral training in neurology. So in our profession, we have board certifications that we sit for, or you can choose to sit for. So my specialty within chiropractic is as a board certified chiropractic neurologist. And so that entailed several years of more training, and then having to sit for the board. And in Texas is where I went to sit for the board. So, and you're also asking a question about what's the difference between chiropractic and
right. Like I mean, just for listeners' general knowledge. So, like for like a general practitioner versus a chiropractor, you're both medical doctors. Can you prescribe medicine? Can you do the typical things that we associate with when we go see the doctor?
So we're not both medical doctors. Medical doctors go to medicine school, just like podiatric doctors go to podiatry school, and osteopathic doctors go to osteopathic school. So we're doctors of chiropractic. So I have a chiropractic degree, and our focus is on the musculoskeletal system, human frame, and the nervous system is what we look at. So, and modern medicine is looking at all sorts of conditions that we don't treat. So.
Perfect. Yeah, thank you. I mean, that helped me. In my mind, I thought it was the same as a medical doctor. So thank you for kind of clearing that up.
So a lot of the training is similar. So a lot of the classes are similar, except when it comes to the pharmacology classes. Ours are a lot smaller than theirs, and then we end up going to palpation classes and learning how to do spinal manipulations and that type of thing. So
perfect. Thank you. And that kind of helps lead in kind of to my other follow-up question. Like you mentioned, kind of you're looking at the whole body, the whole person in this field. Part of what we're doing with Food Drives Mood is trying to increase awareness about movement, food, kind of your mental space as well. Like how does that all blend together in your opinion, and how you try to help people?
So you're wanting to know holistically how we look at the patient. So when we are evaluating a patient, we're looking at their. I look at the patients through a lens of movement, and so I'm always looking at optimal movement for the patients. And when you have people break down in their movement patterns, that's usually when they have low back problems or neck problems, and so that's the lens we look through. And I like to do a brain-based lens to see, like for example, I was showing you guys earlier, I have the gait analysis software that looks at gait, and that will identify certain areas of the body that aren't functioning properly. So, for example, when you look at the pelvis, if the muscles down there, the glute muscles, the glute medius specifically, isn't working properly to stabilize, it causes shear forces on the low back area. And so we know that people that have recurrent low back problems, when we look at their brain, they have less of a representation in the area of the brain that we call the somatosensory cortex. It's a map in the brain of all the different parts. So the low back is not represented as well in somebody that has chronic or recurrent low back pain. So our job is to prescribe treatments or therapies for them that helps expand that map in the brain so they're less likely to have flare-ups or exacerbations in the future. I mean, as you know, a healthy diet always helps everything, right? Fills in all the gaps. And we do, usually on the first visit, we'll do supplement recommendations that are targeted to the patient to help their specific condition get better quicker. So
something I find kind of interesting to this, my own personal journey is, when you're getting adjusted or you're trying to fix something that bothers you, it might not be the direct location. I think, it might be a point in your body that's related to a totally different part. And it's always mind blowing to me. But then as I learn a little more, that's not new. It seems like Asian medicine has been putting those practices into place for quite some time.
It's like the song when you were a kid, like your hip bones connected to your knee bone, Yep. When you were talking about how that patients that have the low back pain, then it shows something in their brain. Is it kind of then you're retraining your brain to kind of pick up that muscle, and so then you help that patient to do that in a sense?
Yeah, that's a great question. So for years we would prescribe something like a clam with mini bands, and we would say 3 sets of 10. And what they're finding is that endurance is more important for the core stabilizers of the spine. And when I say core stabilizers, I'm not talking about butt abdominals, low back. I'm talking about the muscles that are intimate with the spine, what we call the multifida muscles. They connect right to it. And so what happens, and what they've found is that if you do an endurance type activity with it, so I do a clam and I hold for 30 seconds on each side, back and forth for 20 minutes, I change the map in the brain. So when the map in the brain changes, I have a software program that's been upgraded that can control the hardware program. If I just do the 3 sets of 10 with the mini band exercises, I'm bulking up the muscle, but I'm still getting those shear forces in the low back because I don't have control. And it's the control that prevents the injury from happening. So the job now is to upgrade the software program so you can run the hardware program. And that's why I kind of shifted more toward brain-based rehab as opposed to traditional rehab. Does that make sense?
Yeah, kind of. And it makes more sense to me, I think, just because my dad had a stroke a few years ago. And so that was kind of how it was sort of described. That they had, like, his arm didn't work well because it was something in his brain that basically got fried. And so they have to, like,
work around
retrain and figure out how to rework that so that his arm.
The difference between stroke and this type of musculoskeletal stuff is that in the stroke you have damaged tissues. The good news is the tissues are already healthy, so you can use those areas of the brain that are already healthy. We just don't use them in our normal lives, so you can target them quicker than it would be for a stroke. So it doesn't take as long to do the rehab. So
that's cool.
Yeah.
Anything that you want to share or say before we end, and then we're going to go into the right eye technology. Let's talk about that. So then if somebody wanted to watch the video later, I'll explain that at the
since I got my board certification in chiropractic neurology, we've added some pretty cool technology. And so we have one that I touched on earlier is the gait analysis software that looks at gait, but we also have this system that has eye tracking ability. So it's not looking at your vision like we would think 20/20. It's looking at the movement of your eyes. And the eyes actually give us a direct link to your brain, depending on what type of eye movement that we're looking at. So if you are in a car accident and been concussed, or playing football or soccer and were concussed, it can identify the regions of the brain that were injured, and then you can target therapies to help rehabilitate those areas. So that's pretty cool. It actually also, if you're someone that has a neurodegenerative condition like Parkinson's or stuff, it gives you a baseline of where you're at, and it will show as the brain worsens, it'll show the changes through the eye. So the eyes are the window to the nervous system. In a lot of ways are the windows to the brain. It also has that program has a eye tracking software. It's eye tracking software, but it actually has a reading program where it actually tracks your eyes. So if you're a kid that has reading difficulty or dyslexia or something like that, it'll actually show that you're not actually hitting the words. And they have some really cool eye tracking games, so you don't know that you're actually rehabilitating your eyes, but it'll have you blow up asteroids with your eyes, or it'll have you to go through a maze with your eyes, and that type of thing. So that's pretty fascinating.
That's super interesting because I personally, someone's been diagnosed with dyslexia, but I've kind of learned to cope and deal throughout my life, and also being a special educator, I work with a lot of students that are struggling with this. So with this eye tracking software and the games they play, is it showing any possibility of retraining the brain to have these people that have dyslexia, so they can maybe find ways to overcome that? So
there's different types of dyslexia, and so if you have dyslexia where it's the eyes aren't working as well as they could, that can make a change for that. So
that's super cool.
Yeah, and then we have one other software that's that we're using in our program. We have a Forts platform which looks at your balance, and that again will look at your visual, vestibular, and proprioceptive system. And we use our proprioceptive system, our feet, to tell us where we are in space, our spine to tell us where we are in space. We use our eyes to tell us where we are in space, and we use that vestibular apparatus, which is your inner ear, to tell us where we are in space. And they all have to be in agreement. And when they're not in agreement, that's when we have problems. So that program is pretty cool, especially for risk fall analysis for older people, or for someone that has been concussed. It will tell them where they are and what their risk level is.
And before, you were telling us too that it's good for those that are in sports to be able to come and almost do a baseline and have that, so that if they do get a concussion, or even, am I right in saying that if one of these things is weak, if you want to say, then as what you can work on in order to catch that ball or throw it faster, or be more alert as to what's around you and on that platform.
Right. Well, with the eye tracking software, the better you see, the less likelihood. And when I say see, it's just that those eye movements being accurate on the field, less likely you're going to be concussed, right? Mm-hmm. But also with proprioceptive input and the visual input and that inner vestibular input, it's super important to have those working. But I think it's good to have a baseline for everybody, not just athletes, right? Because why would you want to wait until you are a fall risk to start? I mean, if you start to see that you have a system that isn't working, or if you have, your eyes are more dominant, like you were saying earlier, when you close your eyes, you fall over. Why wouldn't you want to work on that now, right? Than waiting till you lose your vision.
Right. No, I don't tip over like a fainting goat or anything. But just, when you do the 1 foot, I get wobbly when I move. I just want to clear that up. It's not like narcolepsy or anything.
Do you make it, are you going to start making this part of every patient?
Yeah, so that's the trick right now, right? Because we have such a busy office. And so I'm finding myself challenged right now to, where do I find the time to fit that in for everybody? Because I think it's important for everybody, right? I get here and I'm busy. So I'm at that point where, do I hire an associate doctor to help me with the patients? And then that frees me up to do a lot more of the neurodiagnostic stuff. I think that's what we're approaching now. So I do think that that's going to be the next evolution of where we are as an office or practice.
So with Dr. Bedford, in a little bit, we are going to kind of walk through this and record ourselves so you can see it. So if you are done with this podcast, you can go and watch us on our YouTube page, and you'll be able to see some of this technology. But before we go, we have one question for you. He is a chiropractor for Watershed, which is a local, huge, awesome country music festival here. And we want to know, how did you ever get involved to be so lucky to be backstage Watershed chiropractor?
So it's not very glamorous.
Well,
I got a call from a gentleman named Mike Stepper, who actually grew up in Ephrata, and I knew his parents. So when they were looking for a chiropractor many years ago, for when the police were at the gorge, they called me, and I went out and worked then. And then I didn't hear from them for quite a few years after that. And then back when they had the Sasquatch Festival, I was able to help another chiropractor there. And then ever since then, anytime there's been a performer or a lot of the backstage people that make things happen needed a chiropractor. They've called me for that. And so we've done Watershed, which has been a lot of fun for quite a few years now. I actually don't know how many years we've been doing it. So it's a bright spot in the summer for us. And honestly, out of all the performers we've worked with, the country singers are probably the most gracious when we work on them and appreciative of what we do. Yeah. And so excited to see us because they're spending their lives on buses.
Right,
you know what I mean?
right.
So, and, you know.
Is that typical for country music festivals like that to have that, or is it just something
I think
that we do?
The organization that Mike Stepper works with is really good about taking care of their people and taking care of the performers. And from what I understand, there isn't like a set chiropractor at festivals from them. Now, all of the performers can stipulate in their contract that they want a chiropractor to be there, and then they have to find someone, but it's automatic for Watershed now. So
That's super cool.
Yeah.
Are there, we went to Watershed once, and we know how kind of crazy it gets on the front of the stage. I'm curious, is there any like G-rated stories that you could share?
Well, no, actually. So backstage is, so you're traveling around the country, and what you care about is food, shower, those personal needs, right? So backstage is just about them taking care of it and just not having that pressure of being on stage all the time. So it's really laid back. It's not crazy at all. It's actually boring. That's what I would say. I'm not there in the evening either. I mean, I'm not there past 7 o'clock usually. So, but if it does, I haven't seen it. So, yeah.
Outstanding. Thank you so much for taking some time to talk with us today. And again, we're going to transition in the show notes. You'll see the link on YouTube. We're going to get to see some of this awesome technology that Dr. Bedford has available for the community and his clients.
Super excited.
All right. Thank you.
Thank you.
Remember, if you like the show, give us a 5-star review on Apple.
Also, take a screenshot of the podcast you're listening to and tag us at Food Drives the Mood on Facebook or Instagram.
Thanks for listening.
All right, here we are.
Head's tilted to the right. Don't worry about it. Just crank it up.
So today a little different. We're not recording from the garage. We're actually in Dr. Bedford's office. He's getting ready to set Christy up on a test, and I'll let him tell you a little more about it after they get the calibration done and he moves through the test.
You see these lines, you're going to push the arrow this way. And then up for that way. And then to the side of that. Are those quick eye movements, and that comes from the actual frontal lobe of the brain is what we're looking at with that. So in a lot of degenerative conditions or neurodegenerative conditions like Alzheimer's or Parkinson's disease, you'll actually see a slowing of those eye movements. Superior collicus, it's in the midbrain, what we call the mesencephalon, and they have grids of everything in space. So what that tells me is that grid for you could use some dialing in or work. So we do that like with what we call like mini saccades. We have like brain exercises where you follow targets and then you pursue down to follow them, and that actually remaps that area and then just gets it more.
Oh, with those like eye tracing.
Eyes open, just look forward. So you can just try to aim for the medial malleus on that line. You can just be in a comfortable stance though. So.
You tell me when you're ready.
I believe so.
So keep your eyes open. Ready?
Okay.
You ready?
Yep.
Okay. Okay. There you go. All right, you can jump off.
Right.
Everything together, you're in the 31st percentile. When we're looking at proprioceptive input, 77th, and then vision, I'm sorry, your percentages are down here. They're all really low. This is how much movement you actually had when you did it. So here it is, okay, I didn't see the numbers. So you're in the 5th percentile when they're converting you to age-related standards. And proprioceptive, you're in the lowest level, 4% for vision. So you could benefit from some balance type therapy is what that's saying to me. Just to give you, when I did this was like, path length was like 7, you know what I mean? And this was like 12, just to give you a difference in the numbers. So they're just higher, so the percentage is too low.
So how much do pre-existing injuries over this? Obviously, I don't have an ACL in either knee.
Right.
A lot of muscle loss on both legs. Does that factor in, or is that just
Yeah.
sheer?
Well, actually, if you take even a step backward, if these were going on before those, that contributed to that, right? So when we look at people that don't have good proprioceptive input to their feet, they're using excessive movement in their ankles and their knees, and they're predisposed to injure those structures that you're talking about. So it's possible that it was an ongoing problem before, and it was just the step and turn with the straw that broke the camel's back. So that's hard to know because we don't have the baseline of this, but this is the baseline we have to work with. So you get proprioceptive input from the bottom of your feet, your ankles, your knees, your hips, all your spinal levels all the way up to the neck. That's what tells you where you are in space, right? And so if you don't have good proprioceptive feedback, which you don't, then you have to rely on your vision system. That's why when you close your eyes, you feel like you're not as stable. So when you close your eyes, you're taking the vision out, and if you don't have a good proprioceptive system, then you have to rely on that inner ear, that vestibular apparatus, to tell you where you are in space. So even with those things gone, you can still rehabilitate the proprioceptive system that you have so that this gets better. Did that answer that for you?
Yep.
Yep.
Do you train that and help
Yeah. So
do that like via
So there, it'd be different. Like he would come in, I would do a physical exam and see what other areas, so let me take a look. So go ahead and sit up. Okay, and just tell me which toe I'm touching right now.
Second.
Okay.
From the pinky.
So tell me which toe I'm touching now.
Big toe. Oh, wait, excuse me, that would be left foot, third toe.
Okay. And tell me which toe I'm touching now.
Left foot, second toe from the pinky.
Okay, and that's great. So all of those were wrong, and so that tells us that in the parietal lobe, where the somatosensory maps, or what we call the sensory map, is skewed, right? So he doesn't know where his feet are, and so if you don't know where your feet are, you don't know where anything else are. So some of the therapy that we would do with someone like that is just proprioceptive feedback. So you stroke. He'd look at it as you're stroking his toe. Or he could look at it and stroke it, or you could take a paintbrush, or you could take sandpaper and do it, and you could remap those areas in the brain. That's where I would start with him, because you don't want to start just doing stork pose, because if I'm doing stork pose, but I don't know where my feet are, then everything else is skewed, right? So you got to start from the foundation and work your way up. And so now's the time to be doing that for you, not 10 years from now, because that's when you look at senior citizens, when they fall, they fracture their hip. When they fracture their hip, they get pneumonia. When they get pneumonia, they die. So that risk prevention starts now, and it starts with doing the rehab. So just watching yourself do that, or watching someone else do it, and then closing your eyes and then having them do it, that remaps that part of the brain.
Do people lose that sensation from shoes?
Yeah.
Like, is that what it is?
That's part of it, yeah. So we're in bondage our whole life in our feet, right? And we keep them in shoes. And that's why you see a big push to the zero drop shoes, because that gives you more awareness and stuff. But I would want to see him in a zero drop, because he has no awareness in his feet. You'd want to get that going first, so that when he's getting that feedback, he's getting proper feedback, right?
That makes sense, yeah.
Yeah.
Interesting.
Yep.